Okay. Hello, everyone. We are the team going over oxygen delivery system. The first one that we want to discuss is the nasal cannula, the low flow. This is the one that patients will use if they need a little extra oxygen to help breathe, or if they have low blood oxygen levels. This is the most common one used in facilities, both in the hospitals, assisted living facilities. And the cool part about this one is that it doesn't really interfere with most ADLs, so patients can still eat and talk while having this nasal cannula on. And it does only give a little concentration of oxygen or a low concentration, 24 to 45% at flow rates of 2 to 6 liters per minute. So very low compared to the other ones. You may be asking, who is this used for? So this could be patients with chronic respiratory diseases such as COPD, asthma, pulmonary fibrosis, also patients with acute respiratory issues such as bronchitis, pneumonia, COVID-19, and then also post-surgical or hospitalized patients. This could be used for patients post anesthesia, if the oxygen levels are low, or patients recovering from heart attack or stroke. And then some other conditions can be heart failure. In some minor cases, you may see this with sleep apnea, and then also for premature babies as well who need oxygen support. It, you may be wondering, how do you use it? Well, it's super simple to use a nasal cannula. You first, of course, grab the nasal cannula. They usually come in different sizes, most popular one being 7 feet, but I've seen it go up as much as 15 feet, and you can also add extenders. But you'll grab the nasal cannula, which is here. You'll connect it to the actual oxygen concentrator or the wall or an oxygen tank, as shown in the pictures seen here. You'll then turn it on and adjust the oxygen level. Typically, there's a little floating ball that you'll see labeled at a number. This number is actually, or the order is set by the doctor itself. So you can't just put a random number. You need to look into the actual patient's chart to make sure it matches what the doctor ordered. And then you'll place this on the patient's face. These two prongs here actually go in the nose. If you can think of a snake's teeth, that's how you actually want to point it into this patient's nose. And then there'll be pieces that go behind the patient's ears. And so super simple to put on for patients, and even some patients can put it on themselves. Some things to keep in mind for the nasal cannula is to watch for pressure injuries. You can actually add protectors for the patients around the ears and even around the face. Nasal dryness, you can actually add a humidifier to your nasal cannula, as we did in our skills lab. And then you also want to monitor and evaluate signs of hypoxia, and then also monitor oxygen levels. And then make sure that the oxygen is not being administered in areas that there may be open flames, or smoking, as oxygen can be flammable.
Alrighty, I'm Jackie. I'm going to be going over high flow. So high flow is pretty much the same as what Jermaine was going over, except it's a different flow rate. This flow rate is going to be able to distribute up to a maximum of 60 liters per minute. It's going to be delivering warm oxygen to the body, especially for those deprived of having like inadequate delivery of oxygen throughout their body. It's referred to as a HFNC, as a high flow nasal cannula. And it does treat, how Jermaine was talking about, certain respiratory illnesses like lung cancers, pneumonia, bronchitis, and it can be used long term or short term depending on the prescriber's orders for it. And then some things to keep in mind is just keeping in mind like where you're getting the power source from, making sure you have a good steady flow of power to it, just in case if it does cut out, if it is a home use one, making sure you do have a generator to use in cases like that. Also keeping in mind that is a fire hazard because it is oxygen, so keeping that in mind for if the person is a smoker or is used in the kitchen. And also about dryness as a possibility. The warm air does prevent nasal dryness, but just keeping in mind the possible infection where it's placed on your nose. And then here we have the different types of nasal cannulas. We have like the thin ones in A, B, and C. And then we also have the thicker ones. You could tell that it's a high flow one by the thickness of the two. It's going to be more of like a core thickness versus like the smaller one. That's to get more of the oxygen into the body.
Hi guys, I'm Ollie. I have the Simple Mask. So it is a single-use oxygen system that is used on patients who need that extra like boost of oxygen, but as a lower rate than of like a Venturi mask, which is going to be talked about later, or a tent. Unlike the cannula that Jermaine and Jackie talked about, it does kind of like interfere with ADL, so it's harder for the patient to eat as it basically covers most of the face. Um, so it's used in like more varied situations. Um, but the flow rate is going to be higher at 6 to 12 liters per minute. How to put it on, I edited a little YouTube clip. It's like half a minute that we could watch while I talk about it. So how to put on, you always want to tell the patient why they're putting on the mask. It's to help them with their breathing because there are definitely some patients that are confused. So always want to like tell them what you're doing. Um, it's a really easy mask, hence the name. There's only one strap that you have to put behind the head and over the ears to prevent uh like pressure sores as well. Because if it's too much pressure, then it could definitely like hurt the patient. Um, and the straps are adjustable, so you can like adjust it to their comfort level as well. And there is usually a clip in the middle to help like with the nose piece as well. But that shows how to put it on as well and how to adjust it. Usually it's used for a good amount of reasons. One most common one is post-op care. So if a patient just came out of surgery, especially like a respiratory surgery, and they need like the extra help of oxygen, it could also be used as well. If a person comes in with chest pain, it also could be used. Whenever transporting patients around a hospital or like a facility, if they're going to like surgery as well, could be helped. People with COPD or chronic obstructive pulmonary disease, it could help as well for more comfortable breathing. Also, patients with mild pneumonia and patients who have a common cold or like mild cases of respiratory infection as well can help with their breathing. Some advantages versus disadvantages. Disadvantages, like I said earlier, it definitely obstructs with the mouth because it's more thicker, so it's harder for them to eat. You're definitely going to have to like take it off completely if you like want to eat. And it could also obstruct if they have like glasses or anything to help them see. But the main advantages of it definitely helps because it's a higher flow rate, so they're getting more oxygen, and definitely like some people see it as more comfortable for them as well because like it's less invasive, so you don't have to put it directly in your nose as well.
Hello, this is Michelle. I will be covering Venturi masks. So the specific mask is a device that allow control over amount of oxygen a patient needs to receive with precision. Why this type of mask exists is because it's to help patient breathe properly because each humans, they're kind of like different. And so each individual, they're very different to their type of symptoms and diseases they have. Some disease they have need like specific amount of oxygen, and so that's why this Venturi mask is designed. And then they usually are used only like in hospital settings, like especially for like emergency when a doctor needs to prescribe to patient with certain amount of oxygen given to them. Who is it used for? It's usually with patient with like severe symptoms like COPD, asthma, and pneumonia. All these three diseases, they have in common is that it's really hard for the patient to breathe. Asthma, it's because the airway became narrow, swollen, and it's filled with mucus. So the Venturi mask, it helps with low oxygen level, which is the main cause as to why it's causing problem to the patient. For COPD, when with too much oxygen, it could potentially stop the patient's breathing. And so that's why Venturi, it provides just the right amount for the patient. With the pneumonia, the Venturi mask, it just helps with the steady flow so that patient could breathe a little bit better. Next. How do we use this mask? First, we connect the device to the oxygen tube and we choose the O2 flow rate. Each rate has different colors. They have blue, which is basically a 24% amount of oxygen. And then yellow has 35%, 37% with the orange, and then 28% with the white, and 40% with the red. So each one has the different amount of oxygen rate given to the patient depending on what they have. The mask is then put over the nose and mouth. Make sure it's secure so that way there's no leak of oxygen. Always check before you put it on that it's the prescribed amount so that way the patient isn't getting too much or too little of oxygen, because if they do, it'll just worsen their condition. And then again, just like make sure there's no leakage, and also just like the patient may feel uncomfortable when they're using the mask because it is gonna cause itchiness and dry, and it'll cause a lot of discomfort to the patient. So just try to like ease them to it, but they need it. They need it to breathe, otherwise they'll die.
Okay, so I had the non-rebreather mask, and basically this mask is used to deliver very high concentrations of oxygen. It's used most commonly in emergency situations. And it has a really high flow rate of about 10 to 15 liters per minute. So the non-rebreather mask works by covering the mouth and the nose, and then it has an elastic band that goes behind the head, keeping it in place. It has a reservoir bag in the front that fills up with oxygen, because it has a tube that's connected to an oxygen tank. And then it also has one-way valves that ensure that the person wearing the mask is not rebreathing any of their exhaled air or the room air. And so the patient is only inhaling oxygen directly from the reservoir bag with no outside air to dilute the oxygen. And then when the person exhales, the carbon dioxide and other gases leave through the one-way valves. And so you can see it here on a person. You see the one-way valves that don't allow any air back in. And then it's connected to the oxygen tank, which fills up the reservoir bag. And a simple mask, which was talked about previously, allows FiO2 60%, and then this mask is up to 91%. So when would you use a non-rebreather mask? Some examples are someone who experienced smoke inhalation, carbon monoxide poisoning, trauma like to the lungs or any other serious injuries, for cluster headaches or any chronic airway disorders such as cystic fibrosis or COPD. And something about this mask is it's only intended for short-term use when a lot of oxygen is required. So it's not meant to be used as an at-home oxygen device, because long-term use can lead to CO2 retention.
My name is Maria. So I have the Oxymizer. The Oxymizer is a device used to deliver supplement oxygen for patients with respiratory support.
It's also known as the oxygen conserving device. It's a device that it's attached to the nostrils and provides higher oxygen concentration and works more efficient. There's two types. One is called, like I said, the mustache, and the other one it's called the pendant. And as you can see in the picture, it has a pendant by the chest, and both on the chest and by the nose. That's where it conserves. It's the reservoir of the oxygen. Next. Thank you. Who uses the oxidizer? It's for patients with moderate hypoxemia to chronic disease such as COPD, chronic heart failure, pneumonia, and asthma. Next. How do you use it? It's typically used for patients who require high flow. It can be from 1 to 6 LPM. It can store up to 30 mLs of oxygen. It conserves oxygen during exhalation, releasing it during inhalation, allowing for efficient concentration oxygen to enter the patient's lungs. It doesn't require any battery or any electronic device to function. Some of the advantages, it's comfortable, less air leakage, cost efficient. It reduces the oxygen delivery by 75%. So the tank lasts longer, and you can also carry like a small tank versus a big tank. It's beneficial for patients who require long-term oxygen therapy, improves their daily activities, and maintains proper oxygen levels. It reduces hypoxemia, and it's, like I said, it's portable. Some of the disadvantages, the initial price of the device is expensive compared to other devices, but later on, it's just few things that you have to change and replace so you can prevent any infections. Sorry. Maintenance is required constant because you want to prevent infections. And if the patient doesn't properly do the breathing pattern, it can affect the way it works. How do you teach a patient? Make sure they buy it from an approved medical supply store. Ensure it's secure and placed over the nose. Make sure oxygen source is connected to the oximeter. Use a pulse oximeter to check oxygen levels. Check for obstructions. Clean regularly to prevent, like I said, infections. And most important, avoid flammables.